What I know is that that doesn't really tell me very much. There are or five different, very, very clearly delineated types. And what works for one, let's say selective serotonin reuptake inhibitors or SSRIs, will work for one. It doesn't work for the other four. And that's why you see them largely being ineffective if you're just kind of throwing them at. Hi, and welcome to The Balancing Point. I'm Dr. John Nieters, and I'm here to make traditional Chinese medicine, functional medicine, and integrative health simple, practical, and fun, so you can restore balance, boost vitality, and enjoy a healthier life every single day. Hi, this is Dr. John. I want to thank you for joining me here on The Balancing Point. And today I have kind of a fun presentation to do with you. I interviewed a woman named Lori Hammer last week. Her podcast will be coming out soon, that edition. And Lori met Julia Ross many decades ago. And Julia is the person who came up with this idea of the mood cure, using amino acids to help treat depression. She's been very, very successful. And now Lori does that. She's very, very successful also. She loves working with perimenopausal or menopausal women that have children and are totally stressed out. And anyway, I really enjoyed speaking with Lori. Now, this concept of the mood cure is a book that Julia published many, many years ago. And in it, she originally identified 4 different types of depression. She now has a 5th. I'm only going to talk about the first 4 today, and how to treat them. So what I'm going to do is take her ideas and then show you side by side how traditional Chinese medicine would treat and has treated and does treat those very same depressions. Now, one of the first questions when someone comes in and says depression, what I know is that that doesn't really tell me very much, because there are 4 or 5 different, very, very clearly delineated types. And what works for one, let's say selective serotonin reuptake inhibitors or SSRIs, will work for one. It doesn't work for the other 4. And that's why you see them largely being ineffective if you're just kind of throwing them at general depression. And so one of the major distinctions for me is, are you having negative self-thoughts? Are you constantly just like a dog with a bone, perseverating, etc., with very negative thoughts? And I contrast that with apathy. You're tired. You're worn out. You just don't care. You don't want to get off the couch. Now, sometimes those can exist together, but that's kind of a basic delineation, and then we'll get into it a little deeper. So Julia identified these 4 types in the book, The Mood Cure: the dark cloud of low serotonin, the Blaz of Low Catecholamines, the stressed out type from low GABA. It doesn't matter what's happening in the world. They're stressed out. And then the too sensitive type from low endorphins. Now, in TCM constitutional basics, we, of course, listen to all of those things, but we identify things a lot by the 8 principles. Is it internal or external? Is it hot or cold? Is it deficiency or excess? Is it yin or yang? Then we look at the 5 phases, which often gets translated as elements, but that's only because the elements were known. But it's actually phases, and you move from phase to phase, from wood to fire to earth to metal to water. And then there's the Zong Fu system. So that's the internal organs. And there are the Zong, which are the active organs, heart, liver, kidneys, etc. And then there are the Fu, or empty organs, that hold things like your stomach and your intestines. And then there's a system called the Qi and blood system. And so we're going to look at Julia Ross's ideas and see how they fit into TCM constitutional basics. So, dark cloud of serotonin. You've all seen this. Hopefully you haven't experienced it. And so repetitive, negative, obsessive thoughts, often accompanied by low self-esteem or insomnia and craving for sweets. Serotonin, we need to remember, is largely made and released in the gut. Different estimates, I've seen 80 to 95%, but it's a lot, or it's released in the gut. And it's largely dependent, once again, on our microbiome, like almost everything else in our lives are. The bacterial balance or imbalance in our gut. It's responsible for rhythmic circadian flow of mood, emotions, sleep. So that's on a daily basis, a monthly basis, an annual basis. When serotonin drops too low, the dark cloud envelops the heart mind, or the sheen in Chinese medicine. And so SSRIs can be effective for this condition. Now, eventually, they kind of wear out, and they're hard to go off of because your body has readjusted to that high level of of serotonin. And so for this one, Julia recommends precursors such as for serotonin boosting, like 5-HTP, which is 5-hydroxytryptophan, or tryptophan. That's kind of at the core. Now, she would recommend some other things also, but that's the core. You've got to get that into the body. Now, some possible TCM treatment patterns, and again, there's not a one-to-one correspondence, and the dark cloud and irritability point to liver depression, qi stagnation. This is very common in the United States. In Chinese medicine, we say that the cause of liver depression is unfulfilled desires. The entire U.S. Lifestyle is every ad you see is to create a sense of lack. It's sense of needing something, of wanting something. So, school, kids I have kids that were getting tutored to get into the best preschools and then to get into the best grammar schools, to get into the best high schools, so they get the best college, so they could get into the best master's program, so they could get into the best doctoral program. So that whole time they have unfulfilled desires. So the classic formula for this is one of the two best selling formulas in the United States, called Xiao San. Sometimes it's called the Peaceful Easy Wanderer. My wife calls it Peace and Love in 20 minutes. And if there's significant irritability and PMS, you change that to a little stronger formula called Danja Xiao San. If there are the repetitive obsessive thoughts and the late in the day carb cravings, those are textbook spleen, qi, and blood deficiency. And the classic base formula for that is called Gui Tong, which is often called the student formula. After you've been in school long enough, and I would see in a 4-year master's program, this could show up by the end of the first year. And that Gui Tong will get them through for a while, and then we have to shift to a little stronger formula to get them through school and get them through the state board exams. So, number 2, the Blaz of Low Catecholamines, dopamine, epinephrine, and norepinephrine. So here the symptoms include apathy, poor focus, low motivation, physical and emotional lethargy. It's just like everything seems too hard. You'd rather just sit in your recliner. Now, these people need stimulants to wake up the brain. So coffee, chocolate, tea, stimulant drugs. These people would go for uppers. Epinephrine is primarily known for causing changes in heart rate and the strength of the contractions. So when you see a tiger is the classic example. You want a lot of epinephrine because your heart needs to beat faster to pump more blood. You also need norepinephrine because that causes the blood to move from the internal organs and be routed to the extremities and the brain to allow us to run away from the tiger. Now, here's the problem. Those are both very heating and very damaging to the system if you have too many of them too much of the time. But also, dopamine is the precursor for epinephrine and norepinephrine. And when you get depleted dopamine with continued stress, you're in deep trouble. You don't care about anything. We're a culture that craves dopamine. Every time you get a like and you press it, you get a little shot of dopamine. It's why slot machines, why people love them. They get this little jolt of dopamine, or a big jolt of dopamine if they hit a jackpot. So, but the dopamine is completely depleted because we use too much of it. And it's the major reward chemical. So, most common Chinese medical patterns are kidney yang deficiency and spleen qi deficiency. So the catecholamines represent the body's fire, the drive, the active vitality. And these are the physical aspect of what we call the gate of life, or Mingmen fire. So Mingmen fire, the gate of life, located between, there's some disagreement, between the kidneys, which means the adrenal glands, or focused more on one than the other. But anyway, this is adrenal energy, because the catecholamines, epinephrine and norepinephrine, are created in the adrenal glands. For the kidney yang aspect, a base formula could be Shen Qi Wan. There are many options, but that's one of them. Now, in order to raise the Shen, or the spirit, uh, my mom used to always say, the eyes are the windows to the soul, Johnny. And it's true that we can see the Shen. We can see if people are there, if their spirit's full, which in this condition doesn't have the Mingmen spark, the heat needed to push it upward. And for that, we would classically use the most popular formula in China, which is Buzhong Yiqi Tong, to help to pull up the center. Very, very popular formula. Here, we're more into the stress formulas. They're more into pulling things up. Here we got the stressed out, wired and tired, caused by low GABA. These are people that are so tired they can barely function, and they lay down and they can't go to sleep. So wired and tired. GABA, or it has been called nature's Valium. It's that critical and so wonderful. So this is GABA aminobutyric acid, is the primary inhibitory neurotransmitter in the brain. Now, epinephrine, norepinephrine, cortisol are all activating different systems in your body. And GABA is the primary thing that slows them down, inhibits them. And this type of patient presents as being completely overwhelmed, including having an overwhelmed nervous system, always stressed, tense, unable to relax, anxious like all the time. Most people are susceptible to having some anxiety around certain events that we don't like, but these people are anxious all the time. I have patients that would send me emails every day, because they're so anxious about what they've eaten and what they did 20 years ago. And so these people are generally GABA deficient. Now, it's easy to find a list of GABA-rich foods, but most of them you have to eat a lot to get enough GABA. So I would recommend, if this is you, that you do a GABA supplement. Now, I'm not recommending anybody take anything without professional support, but I would use GABA or supplements that support GABA, because those can alleviate this condition, and it needs to be alleviated. These people will die very young. Right? In fact, I have several patients that every time they come in and they're so stressed out about things that happened 20 years ago, 10 years ago, and they're wondering if that will kill them. And I say, no, what will kill you is your anxiety, because you're pumping yourself full of stress hormones. So in the whole yin yang, yin being the substantial, the cooling force, yang being the energetic healing force, GABA is classic yin. It cools, it grounds, it anchors the nervous system. And the most common TCM patterns for this are liver yin and blood deficiency, and possibly liver yang rising or heart yin deficiency. And so again, we'd be looking at the whole person, not just this one condition, to see what's at the core of it. The base formulas for this condition are generally Shuangzhao Rentong or Tianwang Bushendong. And people will look at it and say, well, those are sleep formulas, both of them. Well, Tianwang Bushendong is a classic cortisol manager, and Shuangzhao Rentong can calm people down enough that they can actually sleep and not have to lie in bed perseverating. And always remember that most formulas would have additions or subtractions. I say the base formula is Shuangzhao Rentong. Yesterday I gave that, but I had 3 other herbs that I added to it to fit the particular person and presentation. Then we have the too sensitive, the low endorphins. Now, our natural pleasure reward system. So you talk to runners and they have to run because they need that runner's high, right? After a mile, it's different for everybody, but after a few miles, they start getting this just incredible high, and they feel great. They feel better than when they're doing any other activity. And that's from the high increased endorphins. Now, Low endorphins, the symptoms include extreme emotional and physical sensitivity, crying easily. I mean, just over things that most people would not even, maybe even notice, feeling emotionally hurt and reactive to the slightest perceived stressors. These people are usually comfort eaters, but they're also often very picky eaters. They don't want to eat nutritious food. They're not attracted to it, but they want comfort food, right? They want something that's going to pick up their energy. And this is also associated with low levels of natural pain relief and reduce feelings of comfort or pleasure. You got no endorphins, you're in trouble. So I've observed significant increases in this pattern over the past few years. This is something I rarely saw 2 decades ago, but now I'm seeing it a lot, a lot. It's frightening. And one of my associates is currently has 4 young nieces with this condition. Constant, intense overreaction to the slightest issues. Mom says, no, you can't go to the movies. Hours of crying and swearing, hostility, slamming doors, right? And so that's a low endorphins. Now, for this, so I've been talking about herbs, but acupuncture works extremely well with this condition. Now, it's hard to get those people into the clinic to get acupuncture, but if we can, there are very specific electroacupuncture frequencies that can help with endorphin release. It's quite magical. These were mapped out in the 50s by a Professor Han in Beijing, where he mapped out which frequencies cause the release of which neurotransmitters, opioids, endorphins, etc. In Chinese medicine, this condition is usually consistent with heart blood deficiency, heart qi deficiency, liver yin deficiency. So you got a lot of organs there. In older females, so this is perimenopausal, menopausal, postmenopausal, this was often been called dry organ syndrome. In the younger kids, it doesn't really fit all the characteristics of dry organ syndrome, but it's very consistent. So Ganmai Datsao Tong is traditionally used for this condition during perimenopause or menopause. I now use it with many young female patients also. Bottom line, if you consider yourself depressed, or you've been diagnosed with depression, or you have family members with, quote, depression, you need to determine the type that you're dealing with here. So there's a 5th type, which is about glucose receptors in the brain, but that wasn't something I remembered from Julia's book. There are moderately effective pharmaceuticals available for about half of these conditions. Okay, about half of them, there are moderately effective conditions, but even though the pharmaceuticals can be effective, that's capital ALL, all drugs have side effects. There have been years when 10,000 people died from aspirin alone. So, there are no drugs without side effects. None. Try diet, supplements, lifestyle changes, and traditional Chinese medicine first. Now, acupuncture is basically side effect free, as long as it's done by a trained acupuncturist. There were a rash of problems done by physical therapists without extensive acupuncture training, and they damaged. I mean, they caused a punctured lung to a very famous professional football player who was then out of commission for months. Now, I don't want to scare you because acupuncture doesn't do that if it's done by an acupuncturist. I am the chairperson of the Acupuncture Advisory Committee for a major malpractice insurance company, and the cases that we see are done by non-acupuncturists. So herbal medicine also has a better safety record than any pharmaceutical. The Cleveland Clinic had an herbal program, and they tracked things very closely, and there were exactly 3 side effects from approximately 500,000 prescriptions. Now, you give any drug to 500,000 people, and you're going to get a lot of side effects. Now, and these were minor. One person had nausea, one person had diarrhea, one person had itching. So before you go the drug route, try diet, supplements, lifestyle changes, and TCM first. So thank you. I really appreciate your being here with me, and hope you tune in to our next podcast. In the meantime, be happy, be healthy. Thank you. Thank you for joining me on The Balancing Point. If you enjoyed today's episode, please follow the show, share it with a friend, and leave a review. Feeling out of balance? Most approaches just manage symptoms. Here, we get to the root. So real healing, real clarity, and balance can begin. Visit AlamedaAcupuncture.com. That's AlamedaAcupuncture.com to learn more, explore our supplements, or book a call. We'd love to hear from you.